Arthroscopic suture and transfemoral fixation for acute post-cruciate ligament femoral avulsion fracture by Sports Medicine Center, Honghui Hospital to Xi'an Jiaotong University. The authors has nothing to disclose. The patient is a 39-year-old woman with a swollen right knee and limited range of the motion following motorcycle accident. Post-operative CT examination of the knee revealed the avulsion fracture of the medial wall of the femoral attached set of the PCL was displaced. Arthroscopy view of the anterior lateral portal, the ACL is fully intact and the tension is relaxed. The PCL femoral avulsion fracture with bone spirit has avulsion from the wall of the medial femoral condyle. A gasper to assist the PCL ligament to confirm that there is insufficient tissue quality and allows for this repair technique. The PDS2 was passed through the ligament substance, used a reload suture hook, then used it as a shelter for Arthroscopic brand suture. A transform bone tuner is drilled into the femoral PCL footprint using a 2.4 mm pin through the guide from the femoral footprint upwards. Through anterior medial portal, use the grapper to replace the PDS2 wear with Arthroscopic suture which loaded with Westlock anchor, the pneumatic. The sutures are then pulled out the joint through the medial femoral condyle bone tuners. There are a total of 2 sutures. One Arthroscopic suture passing through the PCL is used to lift the ligament tension, and the other one suture is passed across the surface of the bone fragment to press down on the avulsion fraction bed. The 4 Arthroscopic suture tools are then lifted into the bone tuners. The ligament tissue of the PCL and the avulsion fracture are pulled in to repression to the footprint area. Once the suture has passed through the bone tuner, the ligament tension is applied. Arthroscopic view of the anterolateral portal shows the PCL to its footprint is appropriate. An incision of approximately 2 cm is made at the middle of the femur according to the skin exit of the guide pins. We choose Westlock anchor inset into the bone. The sutures are tensioned use the wheel to approximate the femoral side of the PCL ligament into the desired position. The final post-operative image was recorded. Compared to the pro-operative image, T2 MIR imaging shows approximate avulsion of the PCL associated with the femoral incision, as indicated by the yellow area.